At PATH, we believe that all children deserve the chance for a healthy life. For us, that's what every invention, every device, every new idea is all about. PATH translates innovation into impact in the lives of families and communities in more than 70 countries. In India alone, you can see the wide reach of our work, from simple ways to save women and babies to the complex world of scientific partnership. With more than 1 billion people, a booming economy, and a skilled labor force, India is a nation on the move. PATH is collaborating with Indian biotech institutes and companies to create new vaccines to fight malaria, rotavirus, and pneumonia. Progress in these vaccine programs could mean a giant step for humanity.
Just allowing the children in these rural communities having a healthy childhood, I think could really unleash their potential in terms of the contributions they can make to society. And here we are talking about, literally millions and millions of kids.
Elsewhere in India, PATH's partnered with the Serum Institute to produce a desperately needed vaccine for epidemic meningitis in Africa, a disease that threatens 450 million people every year. And there's more. PATH is working to reduce malnutrition. Despite India's economic growth, 1/4 of the population still lives on less than $1 a day and struggles for food. In Hyderabad, 11-year-old Rajender often arrives at class without breakfast. He and other students show signs of anemia.
Majority of children come to school on an empty stomach. With that what happens, they can't pay attention, they are lethargic, they don't feel like studying.
A government program provides a daily meal of rice with bits of vegetables and sometimes an egg. PATH is moving forward to introduce Ultra Rice, an innovation that mimics the look and taste of rice, but adds vital nutrients to the staple food of half the world's population. With better nutrition, children like Rajender are healthier and more able to learn, building blocks for the brighter future every child deserves. Scientific ingenuity in the laboratory is easy to observe, but if you look here, you can see another kind of innovation, just as vital. Inside communities, PATH is touching even the tiniest homes and making an impact. In Nanded, India, 20-year-old Pranita Ingoli is 8 months pregnant with her first child. She is a shy young woman who lives with her husband and 6 of his relatives in a 2-room shanty and knows all too well that pregnancy and childbirth in her world can be life-threatening. Every day in India, 2,700 newborn babies die, an infant death rate nearly 10 times that of the US. Millions of people are packed into vast slums with little or no sanitation and clean water, trying to scrape out a living. Even pregnant women work construction or day labor to survive.
It's not just going and fetching water from the tap, or it's not just cooking and managing the home and the family, but also doing a 9-to-5 job. So she works literally till the last day of her pregnancy.
Beyond the toll of work, women are commonly undernourished.
Most of them eat after everybody's eaten in the family. So whatever are the remnants, they would, eat whatever.
To make matters worse, many women give birth at home without trained help rather than at the hospital, risking serious complications and death. 20% of all deaths in childbirth and pregnancy worldwide occur in India. It's no wonder Pranita worries for her life and her baby. But PATH is making a difference. Our Sure Start program is working with local groups in urban and rural slums for safer pregnancies and healthier babies. PATH mobilizes neighborhood health workers to reach out to pregnant women like Pranita and, over time, build trust and inform them about nutrition, hygiene, and medical care. Together, they learn the importance of practices such as taking iron and folic acid supplements, giving birth at the hospital, early breastfeeding, and keeping a newborn warm.
Because of these people coming here, the pregnant ladies are getting a lot of information.
Early in her pregnancy, Pranita was approached by Radha Doyabali, a health worker trained by PATH, who helped her get immunizations to protect her baby and explained how to improve her chances for a healthy delivery.
I made it a point to go for regular checkups. Otherwise, I wouldn't have been so regular.
The results? Real impact in the life of a young family. On January 11th, Pranita delivered baby Pintu. Full term, a healthy 7 pounds, born safely at the hospital. Mother and son are thriving.
So I think the whole focus that the babies have to survive and they have to be healthy is something that's going to give India a very stronger generation, a stronger youth. If the foundation is strong, I think a lot can happen in our country.
This remarkable, life-changing work is unfolding all over the world. This is why we ask you to join us at PATH, because together, we can be a powerful force for change. Through innovation, PATH delivers lasting impact, because every baby, no matter where they're born, deserves to learn and grow and live in good health. Together, we can create a world of hope.